Hey guys, I'm Dave Hess. Having a neck injury has to be one of the scariest things anyone could face. It not only affects you athletically, but through all aspects of life. Now, treatment plans generally range from something as simple as massage therapy all the way up to neck surgery. But what if I were to tell you there's a machine that could not only determine how strong or weak your neck is, but also strengthen it at the same time? Well, we're here at Active Health Center in North Palm Beach, Florida, to show you what the MCU or multi-cervical unit is all about. This is... All right, so we're here with Dr. Colin Brew. Doc, thanks so much for doing this with us.
Thanks for coming. I'm glad you came.
So, in an overview, what is the MCU?
All right, so if you look behind you, this is called the MCU, or the Multi-Cervical Unit, okay? We introduced it to our practice about 8 years ago, and it's just a state-of-the-art technology where we can actually physically not only diagnose and test your neck, but from those results and from the diagnosis, it actually then becomes the rehab and the treatment. So we've had a lot of people on it, not just athletes for kind of where you're here for today, but people with pain, people with arthritis. We've had people with strokes and Parkinson's, and they've been able to see results and actually get improvement from those conditions.
Okay, so strokes and Parkinson's, so it's not just for athletes.
Not at all. Everybody can benefit from the technology. Okay. We've had people it really just gets that specific to where from the actual regimen itself, again from the testing, people can strengthen their muscles. As their muscles get stronger, the conditions they suffer from, they get to heal, they feel better, and most of all, the pain starts going away.
Okay, so that's interesting. It's not just for athletes, it's pretty much for anybody. So being an athlete myself though, what kind of conditions would it help for people who are active and exercise?
Well, in the athletic forum, we could use it two ways. Either we could get to where we want to do injury prevention, so where we can, again, once we test you, we can see where the strength is, where the balance is, and say you're a football player, say you're doing things where you're taking trauma, wrestling, etc., where you're in different positions, we want your neck as strong as it can be. And number two, if you do have an injury, if we have the strength going into it, you recover significantly faster.
Okay.
Versus if, again, you have an injury, say you suffer from a disc condition or something that's laid you up for a while, we want to make sure that the tissue can heal so much faster, and that's why we do a lot. It's basically a physical therapy type modality.
Okay, so it sounds like the first step is just coming in and getting tested.
Well, we want to see if you're a candidate, so what we do in our office, we do put you through a comprehensive evaluation. Mm-hmm. From there, we will determine one of the doctors if you would be a candidate for. There's a couple conditions that we don't put you on right away. Okay. From there, we test you. Okay, the way the testing does is we put you through 16 different ranges of motion. The machine records where your strength, where your balance, and where your range of motion is. Okay. From that, we review all that data, and then we determine your exercise regimen from that.
Oh, great. Well, can you put me through a test?
Absolutely. Are you ready?
Continue.
Okay, so what you're doing now is you're doing the isometric testing. Okay, so there's always somebody with you. We're coaching you through the whole process. During this process, the machine itself will not move. Okay, so if you listen, you're going to cue on her. Go ahead and push.
Continue.
And as you push, what you're doing is we're isolating those specific
Test
muscles.
completed.
So you can see Dave is turned a little bit to his left. We're only focusing on certain muscle groups. This machine itself is physically gonna record where his strength and where his range of motion is at this level. From there, we put him through 15 other ranges of motion, but again, we're right here, we're coaching him, and we're making sure he's doing it properly, not to injure himself. So Dave, this is the very end of the data we get from your testing. So if you can look at your results, this is what we call a radar graph. You can see that as an athlete, you have some pretty good strength, but there's a lot of specific room for improvement. So if you look, we have these indentations where your weaknesses are, and subsequently that's where your pain is. So you see these little indentations, that's where your body is compensating, and that's why it hurts in those spots, because it's doing more than it should. Where we have these little cavities, that's the ones we have to focus on. And not only do we want overall strength, ideally we want you between the red and the green. This is you in the blue. So we're going to create the regimen to get you to that more optimal level. Again, so you can function well as an athlete and prevent injuries. And if you do get injuries, we have the stability so you'll recover faster. All right, Dave, so what we're going to do now is we have your testing. So from there, we came up with a specific regimen for you. If you remember, you weren't just weak, but you had a lot of imbalance. So it's not just focusing on the pain side, but we have to get the other side just as strong so we have the stability. Okay? So from there, from the testing, we're actually going to start at very specific angles and specific weights based on what your test was. So what you're going to do now is you're going to go right into the cradle here, and then you're going to do a rep. So you're going to go backwards in this case,
1.
And you're just going to continue according to when she cues you.
Continue.
Okay.
How does that
2.
feel?
Feels good.
It's good. You can feel that it's isolating.
Continue.
Yeah.
Right, so
3.
really hard to reproduce this in physical therapy because again,
Continue.
we have the specific angles
4.
and we have the weight according. When you do regular physical
Continue.
therapy, a lot of
5.
it is you're just pushing against isometric or pushing against a
Continue.
ball. It's just not specific
6.
enough.
Okay. Studies show that patients test about 93% stronger after 4 weeks of treatment than when they started. And after 6 weeks, their pain decreases 70%. That's incredible when you think of all the people that suffer with neck pain on a daily basis. We'd like to thank Dr. Weinberg and Dr. Brew for showing us their incredible machine today. You can get links to their site on our site, realfit.net. Come back and look at new videos soon. Thanks. Studies show that patients test